I'm Balagopal, founder and former CEO of Terumo Penpal Limited. I live in Trivandrum and I've been working here for the past nearly 30 years. I feel that the biggest impact on public health must happen in small interventions through the primary healthcare system, especially in the panchayat level. And we have been working with the PHCs and the community health center in the panchayat where my factory is located for many years. And after my retirement, this is one of the projects in which I continue to be engaged with. We have selected for our first project to hire a team of volunteers who will clean the toilets and public areas of and disinfect the public areas of the community health center every day on a regular basis under proper supervision using proper equipment. The entire expenses are met by us, and this program has been going on now for the past few months, and judging by the public response, the feedback is very good. We are getting excellent cooperation and support from the doctor there. In fact, the motivation of the doctor at the community health center and a local panchayat member has been one of the reasons which has motivated us to do this, because that is one very important element. If this kind of public-private partnership initiatives have to succeed, both sides have to get involved. Fortunately, in this case, the doctor and staff of as well as the panchayat members were very interested, and that has given us the motivation to do a good job. This is a typical community health center with about 40 inpatient beds. Today their outpatient load is about 400 every day. Their sanction strength for doctors is, I think, 3 doctors and some almost 10 nurses, but the actual strength is much below this, which must be the case in community health centers across the country. So one of the areas where I think public-private partnership can help is that until such time as government finds the means to post the necessary people, private entities can come forward and put people on contract to complete this work, because the impact will be huge. My wife and I have created a trust which we call the Anaha Trust, and this Anaha Trust primarily focuses on rural schools and public health in rural areas. So we today meet the entire expenses of this team of cleaning staff who are drawn from the local women's self-help group called Kudumbashri, who are providing the manpower needed for the cleaning operations at present. It may be a little early in terms of patient outcomes, but the impact on visitors, patients, and the doctors and the medical staff working at the community health center has been very good. They all feel very encouraged, and I think the people of that area are beginning to take pride in the community health center and also a sense of ownership. And the local block panchayat member who has been supporting us actively has also devoted funds to acquire a queue management system, so that waiting of people for outpatient consultations is also rendered much more convenient, because appointments can be fixed and they can be notified when the time of the appointment arrives. So the importance of committed staff in ensuring that public health care delivers better than expected outcomes is clearly brought out in this particular case. Till some time back, the outpatient load in this particular community health center was less than 100. But after this particular doctor took over, it has now risen to more than 400, which indicates that more and more patients felt confident that their troubles can be taken and their problems can be addressed here in the community health center in the panchayat instead of going all the way to the city. So this is the role which can be played by one individual in putting money into the pockets, literally putting money into the pockets of people, because most of healthcare spending in India even today is out of pocket. Our idea is that if we can develop this community health center, our idea is to develop this community health center into a model community health center by ensuring that the wards are made neat and sanitary and the beds and everything are fully under repair. There is some construction still going on with some ramps to enable stretchers to be taken to the, because it is at various levels since it is a multi-level building. Once that is completed, then we hope to, the block panchayat member has also promised to have a coat of whitewash done for the whole thing so that it will look neat and tidy. And then we will help them to rearrange the workflow within the community health center, which is today a fairly congested building in 2 or 3 different levels. But I think we can bring about a rational movement of people and materials in this. Once that is done, then we can treat this as a model community health center, which can be, which other community health centers in other blocks in the district and neighboring districts can come and see and look at emulating. And we will be happy to support such upgradation of community health centers in the neighboring districts also. One thing which we find is that the moment patients start using this facility, that is actually the success, because that means they no longer feel the need to go to the city, which is about half an hour away, for meeting their basic primary healthcare needs. Once that happens, the local community will take ownership of it. We have seen the same thing happening in the case of 4 primary service, 4 lower primary schools, government schools, which we have been supporting for the past few years. In the initial days, they did not even have separate toilets for boys and girls. They did not have a good kitchen for cooking the noon meal scheme, etc. But with our little bit of support, and once this upgradation happened, a sense of pride started developing among the local community there. And these primary schools where enrollment was dropping, now their enrollment is full. And the parents, the PTA, the Alumni Association have all got very active. And I don't think our support is any longer needed for any of those schools, because the local people have taken ownership. So that's the beauty of this kind of model, that once you show them how to do it themselves, then they take it over, and they don't need other than some kind of technical support and maybe some resource support once in a while. That's the beauty of community involvement, is the way they very quickly get the idea and take over management of their own lives. My company was a pioneer in India to make blood transfusion bags, which are used in modern blood collection, replacing the old glass bottles. We were the pioneers in India. The know-how for this was developed by Government of India lab in Trivandrum called the Chitra Tirunal Institute, and it was transferred to us through the National Research Development Corporation of India under Department of Science and Technology. This project has been considered as one of the most outstanding successes of publicly funded R&D, and we got a national R&D award for that also. Today the factory employs 1,000 people, and products are shipped to more than 50 countries across the world. It is considered the largest single location manufacturing facility for high technology blood transfusion bags in the world.